Hello, this is Clinical Reflection number 11. So today was a good day. It was not quite a busy day as how it usually would be some nights, but it was a good day. We did have a new patient come in, a new admission. The rest of our patients were previous admissions, so we knew what their plan of care was. But for this patient, she was an 82-year-old female, came in with chest pain, and also she has pneumonia. They confirmed that with doing an X-ray. She does have a history of AFib. We had an opportunity to view her EKG because it was ordered from the provider. So they came to her room to perform the EKG on her. That was interesting to see how they do things and just looking at all the different intervals on the EKG strips that they use and how they confirm what type of rhythm she's in. She developed a left um, BBB um, rhythm on the pattern, which is the issue with the ventricles. She also had premature atrial contractions noticeable. Once again, that history of AFib was noted. So she had a pretty critical thing going on. She reports a lot of vomiting as she was eating, so she had a change in her diet due to that. She had SCDs on because she was immobile. That's just going to prevent any clots from forming, and she also was getting heparin shots as well. We did administer IV antibiotics for her because most likely it is due to an infection. She also has an infection going on, considering that she also came in for pneumonia. And she was also getting Lasix because she has decreased urine output. So that Lasix is going to make her have a more of an output um, for her better as well. So for her, the plan of care was just comforting her and just following the orders to monitor her. She was monitored on tele as well. So we just tried to make sure she was continuously monitored and stayed in sinus rhythm. And nothing else after that. She did need oxygen, 2 liters of oxygen, because she was sitting at 93% on room air. So that was the issue with her. She did have a consult, of course, for cardiology. So they came in and talked with her as well about the issues that's going on. One of our patients that I want to circle back to, the patient was admitted for suicidal thoughts. He was there again. He was still there because he's being corrected. Um, he basically with him, the plan of care is administering him his Librium, which is something that we do give patients who are experiencing like substance abuse or like with the withdrawal that they may be experiencing. He does have tremoring, like I said previously, but today you see it more noticeably. He's developing the tremors more excessive now. Whenever we performed the assessment on him to hold his arms out straight, he really couldn't do it. He was tremoring and everything. He did have a nicotine patch. He was dependent on that. Um, but you can just tell, like, since it is second day of, maybe him experiencing his withdrawal, it is different and a slight change. And you can see it's more like effective to him now. Like he's really experiencing the withdrawal symptoms that we see in him. So he was also given Ativan as well um, for his diagnosis as well. But today was a good day. It wasn't too much going on. It was the same patients. The suicidal patient, he did need to have a sitter. My nurse ended up having to be a sitter at some point due to like one of the techs needed to take a break. So I was just in there with her and the patient. We were just talking, basically just trying to distract him from all the negativity that he may be going through with his condition and um, just with everything that's going on, his depression, the suicidal thoughts. So I was providing compassionate care to him, just reassuring him, just making sure everything is going. We're going to continue to follow the provider's orders for him to help him feel better. And also, me and my nurse noticed that he needed a new IV in because it was getting swollen. And then whenever we did flush his IV, he mentioned that it burns, and we were just flushing with normal saline. So the way we installed his IV, it was on his forearm, but it was kind of like backwards this way. It was interesting because to me, she said that instead of how we're used to going in with the IV insertion towards upward this way, instead we needed to go towards the heart, so we have to go down with the IV. So she did that one due to the different direction. I never did it in that direction before, but that was a good learning opportunity for me. So I learned something new upon inserting IVs. Because if we were to insert the IV the normal way, like down, like upward, it would just be going towards his hands, and that's not what we want. And if we were to push medications through that, it would just irritate his hands, and it wouldn't get throughout his body. So we would have needed just to go down so that it can go upward towards the heart. So that was something interesting from today. Um, and that's all. Thank you.